everyone. I'm Christopher Kent, and today our guest is Dr. Joel Alcantara. And Joel's a pretty amazing guy. He's a doctor of chiropractic. He's almost a Ph.D. Almost. And he has been extensively involved with research, particularly for the ICPA, the International Chiropractic Pediatric Association. So welcome, Joel.
Thank you. Thank you. Pleasure to be here.
Well, our goal today is to have you share some of the information that you presented at the Immunity Conference and to give us your vision as to where chiropractic is in the grand scheme of things. You've done a lot of work in salutogenesis. How does this relate to immune function and well-being?
Well, I think the whole concept and application of salutogenesis is something that we've been missing or have finally gravitated towards as a profession, just because the breadth and depth of the relationship between, what we've been looking at in terms of our chiropractic philosophy. How does chiropractic health fit into day-to-day life? How does chiropractic care lead to improved quality of life? Remember the saying, chiropractic adds years to life, life to years. I think with salutogenesis, we've finally found a framework that we can work from. As a researcher, the most challenging thing has always been, how do you take something that is of a philosophical nature and give it measure? How do you measure these things? And I think
I lost him.
Does this lead to the other challenge?
Hello, Brooke,
Oh,
I lost him.
Me?
It froze for quite a while. I don't know.
Oh, okay. So let's start again then.
Okay.
You want to start again, Chris?
You can just restart. Dr. Kent, you can ask him the same question, and you can start with.
Yeah, I'm trying to think when did we lose it? After the intro?
No, it was just recently. But you can start again.
Okay, well, we'll keep the introduction. That was good.
Okay. Cool.
Cut and splice. That's what I'm learning.
Okay. Okay, so Joel, could you give us your take on the relationship between chiropractic immune function and a topic I know you're very passionate about, salutogenesis?
Oh, thank you for asking that question. So I believe that at the core of really what we do as chiropractors, in terms of our approach, clinically, philosophically, is very closely related to salutogenesis. One of the things that I talked about in my presentation was, what is it? How is it defined? And in the 1970s, when Antonovsky, medical sociologist, came up with his concept of salutogenesis, he was looking for a means to approach healthcare from a non-pathogenic point of view. And that aligns itself so well with chiropractic philosophy, with this focus not on pathogenesis, but on salutogenesis. And furthermore, he wanted to move away from focus that look at pathogenesis and look at health and well-being. Chiropractors talk about wellness care.
I lost you again.
We don't own it.
I lost you again.
Geez.
Brooke, are you having the same problem?
Is it me?
How does it look on your end?
I can still hear you. It gets a little frozen, but it's not too terrible. I don't know. You're super clear and with us right now. It's just.
I was going to say, I don't know if we should try redoing the call or reconnecting or something.
Let me exit and go to a 5G.
Okay, sounds good. We'll stay here in the same meeting, so it should be the same link.
Okay.
Okay, let me X out and try another. Let me connect to the 5G Wi-Fi that I have. Maybe that'll be better.
Thank you. He's connecting to a different Wi-Fi, so hopefully he'll come in
Oh,
with a
okay.
little better
Okay.
quality.
Okay. How does? Hopefully we won't get, or I won't get frozen. So
Okay.
Okay, we'll try it again. No worries.
Okay, we'll try it again.
Either that, or I'm going to go to some Starbucks somewhere and, schedule a different time.
Oh, I've done that. I remember during Hurricane Sandy when everything was shut down, I would go to Dunkin' Donuts and buy a mocha latte and sit there all day because their internet was working, no one else's was. Anyway.
Anyways. Okay, why don't we start again? I mean, it's a 15.
Okay, yeah, we'll start from scratch.
Okay.
Hello, everyone. I'm Christopher Kent, and with us today is Dr. Joel Alcantara. And Joel's a pretty amazing guy. He's a doctor of chiropractic. He's toward the end of a Ph.D. program and will soon earn that degree. And he's been very active in chiropractic research, particularly with the ICPA, the International Chiropractic Pediatric Association. And his passion is salutogenesis. And I always love the term salutogenesis. Chiropractors define themselves in terms of what they're not. They say, oh, we're drugless, we're non-surgical, we're non-therapeutic, we're non. And I said, it's kind of like meeting someone at a party and asking, what do you do? And they say, well, I don't prepare food. I don't wire houses. Well, okay, what do you do? So tell us a little bit about the concept of salutogenesis, how it relates to chiropractic and immune function.
Thank you, Dr. Kent. Pleasure to be here. As part of my presentation at the Immunity Conference, I introduced salutogenesis. I'm sure a lot in the profession are well aware of it. And just as a review, salutogenesis is a concept that came out in the late 1970s by a medical sociologist by the name of Aaron Antonovsky. He was looking for a different approach, a different framework towards health. And he wanted to move away from this idea of pathogenesis, looking at laboratory measures that measure, how sick you are rather than how well you are. So one of the things that he came up with was that health was not the absence of disease, but rather within a spectrum, where on one end of the spectrum you have total health, and on the other hand, you have total ill health. And I'm sure most chiropractors are familiar with the term DIS-Ease, and that's exactly how he described it. So one of the things he looked at, and again, this is based on his both professional and personal experience, was he asked the question, why do some people thrive or survive an adverse situation? And the classic example, of course, are being in a concentration camp, being in a war zone. And in today's epidemiology, a while back it was chronic disease, but now obviously with this pandemic, we're looking at, microbial disease epidemiology. Why do people thrive, and why do people just basically break down and fail to do what they do, for example, day-to-day living? And Antonovsky said this is really dependent on their sense of coherence. And he said sense of coherence actually has three concepts or domains. One of those things is comprehensibility. Now, from a healthcare or a chiropractic perspective, comprehensibility is really this idea that what is your concept of health? Do you understand what health is? And for the individual, and I'm sure many chiropractic patients have gone through this, I've gone to the medical doctor, I've gone to everybody else. Why am I still unhealthy? Why am I still suffering from whatever it is that I'm suffering from? So that's comprehensibility. Are they aware of really what ails them, what's going on with their body, what's going on in their environment? The next domain of salutogenesis or sense of coherence is this idea of manageability. And again, going back to that chiropractic patient, they've been to everybody else. Finally, somebody says, maybe you should try chiropractic. They go to the chiropractor, and I'm sure a lot of our listeners are those types of chiropractors that say, look, you may know what chiropractic is, but this is what chiropractic is. This is our vision of chiropractic in this clinic. And it's not about this, it's not about that. It is subluxation-based care. So there's a component of comprehensibility, manageability, and finally meaning. You know, what's in it for that patient? Why do we have chiropractic patients that continue to go see their chiropractor on a regular basis? And to some people, you know, it's out of their mind that it's lifetime chiropractic care. So a lot of chiropractic patients have gravitated towards this concept of comprehensibility, manageability, and meaning. And really, that is at the root of what salutogenesis is. And of course, a lot of chiropractors have gravitated towards salutogenesis. The other component, I believe, that's really important for chiropractors to understand in terms of comprehensibility, manageability, and meaning is what is chiropractic health? For a lot of the chiropractors that I have met and have seen in clinical practice, you know, this idea of what is chiropractic health? That is this idea that, you know, if you are subluxated, so again, this component of comprehensibility, if you understand that there's something with the skeletal frame, the spine, that is misaligned, again, comprehensibility and manageability through subluxation-based care, right? Fix that alignment, create those neurological impulses that's supposed to happen that we're still at the challenge to characterize. You know, again, this idea of subluxation-based care, you get rid of the subluxation, you allow innate intelligence to flow. Again, those are all concepts within the salutogenic framework. So I'm very, very excited to do research on salutogenesis and in the concept or framework of chiropractic.
So how do we measure these various dimensions? You know, those are beautiful philosophical constructs, but how do we operationalize their measurements so we can track and determine if there's an improvement in a patient?
I'm glad you asked that question because we're actually in the middle of doing a series of studies looking at sense of coherence. Aaron Antonovsky, before he passed away, came up with a 29-item questionnaire that measures exactly that. 29 items measures an overall sense of coherence, and certain questions measure comprehensibility, manageability, and meaning. And our initial studies so far, number one, has shown that we can do this. We can measure this in chiropractic patients. And the other thing, of course, is what's the context of this? So we not only measured sense of coherence, but we also measured quality of life. And we didn't care what type of patients came into these practices that we were doing the research in. They could have low back pain. And sometimes I jokingly say they could have rigor mortis. You know, if they can get an adjustment, who knows what would happen. But you know, I'm being facetious, of course, but again, they came in with a slew of clinical presentations and we didn't care what it was because that really is chiropractic. I don't care what you walk in with. You know, I perform my examination as a chiropractor. I perform my care as a chiropractor with spinal adjustments and see what happens. And again, this goes back to the core of salutogenesis and sense of coherence and chiropractic health that I was talking about earlier. So what we found was with a course of chiropractic care, we were not only able to measure sense of coherence changing, but we were also able to measure quality of life measures such as physical functioning. Are you sleeping better? What about your clinical depression? What about your anxiety? What about pain interference? Those are measures that we perform. The outcomes measures that we use. I'm sure for those of you who participate in our practice-based research network, it's the patient-reported outcomes measurement information system. These are validated outcome measures, meaning to say they're measuring what they're actually saying they're measuring. And we're very excited about some of the initial studies that we've done, and we're in the process of publishing them now.
Oh, well, we'll certainly be looking forward to that because to me, it's very exciting for chiropractic to be in the context of quality of life, meaningfulness, the things that make life worth living, the concept of correcting vertebral subluxation so that an individual can express their potential. And of course, there are so many dimensions to it. You mentioned depression and anxiety, which we know with the pandemic have exploded in terms of prevalence. And we also know that if a person's perception of themselves and their environment, as Dr. Barge said, is compromised, every dimension of the human experience is going to be compromised. And that, by deduction, would seemingly include immune function as well.
Yes. So part of my presentation was, the overall question was, is there a relationship between sense of coherence and immunity?
Mm-hmm.
And later on, part of my presentation was, what's the connection to chiropractic? So in the last 15 to 20 years, we have been challenged heavily. That is, there more to chiropractic than just neck pain and low back pain. And certainly, I'd like to think that part of my research and part of the ICPA research agenda has gone towards addressing that question or addressing that challenge. And so when we're showing that when patients go to a chiropractor and their anxiety and depression actually improves or goes down, 20 years ago, that was unheard of, because 20 years ago, the research was focusing on neck pain and low back pain. Don't get me wrong. I think we're very good with those types of patients, but there's so much more to chiropractic. And I think things are opening up now. And with this pandemic, and the restrictions in place, obviously quality of life is compromised. What are chiropractors doing to improve the quality of life of their patients? So one of the things that I think that we're looking at, and one of the things that I presented, is there a relationship between sense of coherence and immune function? And as you all know, Dr. Kent, the biggest challenge is, what is a good outcome measure for immune function? There are so many neurological, physiological pathways that lead ultimately to, say, changes in cortisol.
Yes.
So, we're challenged by that, but I'm very, very happy to see from the literature review I presented that there are ways to measure immune function in relation to certain situations. And at the core of that is stress. It doesn't matter whether you have breast cancer, scleroderma, any other kind of pathological type of diagnosis, everybody goes through stress. And of course, beyond the scope of this conversation and the relationship with the HPA, I was able to show with the literature review that the more compromised somebody's health is, whatever that medical diagnosis is, and I would even add to that subluxation, their immune system is compromised. And with certain types of interventions, and again, the next step is, can chiropractic care, we know that chiropractic care improves quality of life. We know that chiropractic care improves a person's sense of coherence. But will it also improve immunological functioning? And I think we can demonstrate that, because we already have 2 of the 3.
And to me, that's very exciting. And that's kind of the focus of the Foundation for Vertebral Subluxation's practice-based research initiative. And we're at this point still reviewing what biomarkers are likely to be most responsive based on previous findings, which ones are feasible to do in an office type setting without significant disruption of patient flow. And I think it will be very exciting to, once again, instead of looking at diseases and symptoms, to be looking at sense of coherence, quality of life, immunocompetence, and nervous system integrity. That's just a fantasy that I hope to see fulfilled.
Well, I think I can confidently say it's no longer a fantasy. I think we're doing due diligence. I think the foundation is doing due diligence by collecting a number of people with expertise in immunology, research design, epidemiology. Dr. Haas is heading that program, and
yes,
we have people like Dr. Christy Kwan, who just finished her MPH from what is that university? Emory University. I'm having a brain fart here.
A very eminent school in the field of public health.
Yes.
Yeah.
And so we have some really good core people looking into this. And as I said, I rarely disagree with you. It's no longer a fantasy. I think it's going to be reality.
Well, that really is an exciting thing. And we appreciate your involvement in the project and all that you've contributed to chiropractic research.
Thank you. Thank you.
So with Dr. Joel Alcantara, I'm Christopher Kent.